Welcome to FUNC YOU UP, the podcast that gives you the best of functional medicine, nutrition, and wellness in 8 minutes or less.
Hey there, everyone. This is Michelle Miller, clinical nutritionist.
And this is Diana Orchant, functional medicine registered dietitian.
Welcome back to FUNC YOU UP. We're so glad that you're here for a great topic today. We have IBS, Irritable Bowel Syndrome. Let's get into it. Let's just start like ranting and getting some stuff off our chest, Diana, about what frustrates us about IBS.
There is so much. And I'd say that it's the number one most common gut disorder. But the reason for that is because it's really this umbrella term that is kind of a diagnosis based on exclusion. We don't know what's wrong with you. You clearly have a variety of symptoms.
We've ruled all this other serious stuff out.
So we're going to diagnose you with irritable bowel syndrome.
And it's interesting because the symptoms, I think if we really started to break down the symptoms of IBS, it probably get to a point where like, hey, who doesn't have IBS? Which is kind of the scary part, right? So it's like abdominal pain, acid reflux, nausea, bloating, gas. I mean, what other ones are really common? Oh, I mean, constipation, diarrhea. Yeah, alternating constipation, diarrhea, seeing mucus in your stools.
Yeah, and we have IBS-D for diarrhea, IBS-C for constipation, IBS-M for mixed diarrhea, constipation.
And it's really just all of these signs from your GI system that something is not right. And now we put a label on it. So did that really fix anything? Did you really need to know that this label of like your bowels are irritable? Like, I think you already knew that if you were having all of these symptoms, right? And I also think what's interesting is that now we're being marketed all of these like over-the-counter products as like the Band-Aid approach. So like there's like the Pepto-Bismol jingle, like that everybody knows. It's like, okay, well, that doesn't actually heal your body. Like you're not deficient in Pepto-Bismol. That's just a Band-Aid effect. That's just covering up symptoms. But I mean, Diana, you know stories of patients who are like taking Miralax every day as part of their supplement regimen to deal with their constipation. Like that's not the long-term game plan. And I hope that's really just covering up a symptom that your body's trying to like loudly tell you something's off.
Right. And I think we just need this entire paradigm shift. We need to move away from really managing symptoms and, taking Miralax every day to make sure you go to the bathroom, to getting to the underlying cause. Like, why aren't you going to the bathroom? Or why are you going far too often? Why are you running to the bathroom 3 times before you have a big interview or something along those lines? And so I think we kind of, need to start with breaking down like what is good digestion, what it should look like.
Yes. Good digestion is not where you have Tums in all of your coat pockets and bags because you just know that you could get reflux at any time. All right. So yeah, good point. So good digestion. Let's just start with upper digestion. We'll work our way down. So good digestion is where there really isn't anything happening. And that's kind of the idea. You're not really noticing any signs of nausea or belching or hiccups. You're not having indigestion or acid reflux. You're not having bloating or stomach aches or stomach pains or cramping. You don't get the feeling that food is kind of just sitting. It's not getting digested. This idea of like being distended or having frequent flatulence. None of that should happen. You just should honestly be like unaware of digestion happening as long as you're eating an appropriate amount. And then in terms of bowel movements, this is always something that really surprises my clients. And we speak about this with such ease because we literally talk about this all day long like it's the weather. So
yep.
I'll have to straight out say to our clients, like normal and healthy in terms of bowel movements is 1 to 3 bowel movements a day. Regular, consistent, predictable, so that you're not seeing a lot of variation in the consistency, the size, the frequency, and everyone does get their own quote unquote normal within those parameters. But you've heard it. People will say like, well, my normal is to go like twice a week. Well, I guess the difference between normal and common is probably what we should be talking about. Like that, it really isn't that healthy. Healthy is going 1 to 3 times a day, and for that to be a healthy consistency, not running to the bathroom, not straining, things like that.
Right. And, bloating after lunch, gas eats night before bed. These are things we hear all the time, and it's not normal. So we want to just get across that no one should, nor should you don't have to live this way. And but at the same time, instead of normalizing some of these things, we want to make people aware that these are warning signs. You don't just have
Yes.
IBS for life. Things manifest, and this is kind of inflammation that starts in your gut and works its way around the body. As we all always say, Hippocrates says disease begins in the gut. So if we send you home with one thing, it's that.
Absolutely, yes. And so let's start with kind of, now we've created this paradigm shift of, we're not symptom treating, we're not just trying to manage this diagnosis or this disease, we're really trying to get to the underlying root cause of it. And so for us, that always starts with running the proper tests and doing the proper assessments up front so that we really know what we're working with and we're not doing like trial and error with you. We're not just like guessing. So our first testing that we do is the comprehensive stool test analysis. So this is a 3-day stool test. It gives us a lot of information. Anything from like, is your body secreting enough enzymes to break down food, to do you have any types of bacteria issues, either not enough good bacteria, some bad bacteria, yeast or candida, fungal strands, and basically any imbalance in the gut flora. Sometimes you'll see that referred to as dysbiosis. But yeah, it's either not enough good stuff or too much bad stuff. And then things like parasites, which nobody wants to see, us included. It's not fun to deliver that news, but again, a super common symptom that obviously goes misdiagnosed. Um, Now, Diana, we hear this a lot that clients will come to us and say, well, I did a stool test with my doctor and like nothing came back.
All the time. And the thing is, if you compare the comprehensive stool test that we have you do versus the stool test that you might do with, your standard gastroenterologist, nothing wrong with either of them. Just the gastroenterologist is usually not testing for a lot of these like fungal strands and the things that Michelle was said, enzyme activity. They're more looking like for the pathology of disease. Do you have like, should we do a colon, like, let's use this as a test for, should we do further testing? Do we need a colonoscopy? Do we need an endoscopy? Does this person have salmonella? Like things that are alarming and need to be treated with medication, usually right away.
Yeah, it's that high level stuff. You're absolutely right. And that's, I mean, I think that's kind of the newer role of conventional medicine, is kind of like that high level, more acute emergency care, which is like great when we find out a client's had a colonoscopy or endoscopy, or that they've, done this testing with their GI doctor, because that does ensure that a lot of the more serious stuff has been ruled out and that we have so much more to work with now that we don't have to worry about that stuff. But just like a blood test, when a doctor orders a blood test, they're choosing what, they're checking off what markers to order. It's the same thing with a stool test. So there are tons of parasites. Like yeast strands that you have to be looking for. If your doctor is not checking off to be checking for ordering all of those things, that's why it's not coming back. It doesn't mean that it was not present. It just means it wasn't looked for. So I think that's a big, point of distinction that is not often made or talked about. Talk a little bit about the breath test that sometimes we have to look into.
Yeah. So sometimes individuals might have more like upper or even middle kind of GI symptoms, whether that be belching or nausea or also poor digestion.
Mhm.
And we'll often need to look for small intestinal bacteria overgrowth, which we have a whole separate episode just on SIBO for you. Um,
SIBO standing for, say it again.
Small intestinal bacteria overgrowth. And so this breath test really tests for different hydrogen and methane levels in our GI system. And so sometimes they're actually often, I think about like 15% of people with IBS often have SIBO that has not been diagnosed.
Yeah, this gas is being released by the bacteria that's moved its way up into the small intestine where it shouldn't be. And honestly, if we can, it's a resilient bacteria. It's a tricky thing to treat and to address. But I think one of the great things about our integrated team at Physio Logic is we kind of all approach it from a different, standpoint. And when you can clear that good bacteria out and really rebuild the gut, Sometimes that's the entire IBS issue for some clients. Sometimes it's just a piece of the puzzle. Not everybody with IBS will have it, but it's certainly something that can't go, without checking out and looking into.
Yeah, and the other testing that we always do is blood work. So blood work surprisingly can actually tell us a lot about various IBS cases, right? Because we'll look at cortisol, which can tell us, it's your main stress hormone. So if you're really stressed, a lot of time people with IBS say, I'm running to the bathroom before a stressful situation. We can look at inflammatory markers to test for inflammation, both in the gut and in the entire body, as well as food allergies, food sensitivities. We can actually pick up quite a bit.
Yeah, I'm so glad that you mentioned the hormones too. Yesterday, I was doing a live webinar on, or July 15th, I was doing a live webinar on um, IBS, and that we got into a really good conversation and some of the questions about the impact that hormones have on IBS. And the idea came up about a woman who's getting her period could have constipation a few days before her period, and then she starts to have diarrhea during her period. And we've had these patients, and they're like, I only have GI issues for like a week and a half or 2 weeks around my cycle, but that's half of every month. We got to get to the root of that problem. So yes, it's healing the GI system, but you can't forget about the other kind of secondary issues, which could be balancing hormones or a lot of things that we'll see on the blood work.
So now let's just dive into our approach for getting to the root cause. If a patient comes into Physio Logic, kind of what types of things that we would do to mitigate IBS and really figure out what's actually going on.
Let's do it. So let's start out with in functional medicine and functional nutrition, there's kind of a widely used gut protocol. You might hear it referred to like the 4R protocol or 5 or 6R protocol. We're expanding it sometimes. But it's basically the idea of removing all of the triggers. So this could be parasites, bacteria, yeast. This could be inflammatory foods, and removing anything that's causing inflammation, and kind of getting that out of the system. I think of this as like pulling the weeds in the garden, just clearing all that stuff out. And then it's replacing with good things. This could be prebiotics. This could be enzymes if those levels are low. This could be anti-inflammatory foods. This could be anti-inflammatory herbs. Repairing the gut, which could be things like bone broth or collagen or marshmallow root, slippery elm, DGL, glutamine, one of our favorites, right? And then replacing or inoculating, we think of that as like adding all the good bacteria back into the gut, so that yes, we've removed all these like bad things, but we want to make sure we have that good gut flora flourishing. So this is like reseeding the population, reseeding the garden, putting those good probiotics in there, maybe using some prebiotics to make sure that they have some fuel. Working with the diet to make sure you have enough fiber in the diet and the right types of fiber in the diet to be feeding all of that too. Did I miss any steps there?
No,
I think general.
Yeah, I think it's really helpful to think about in that gardening. We weed,
weed, seed, and feed.
Yeah, weed, seed, and feed.
Yeah, so it's this process that it takes some time. You gotta. I'm very passionate that with our patients, I know I'm rattling off a bunch of different herbs, but that's because you use everyone in their unique state, because not everyone's IBS presents the same way. So we don't have the exact same approach with every single patient on what enzyme they're using, let alone like what healing agent we're going to use to repair. And I think that's like more of a personalized tactic that, you look at the energy of the herbs, the energy of the person, and kind of what their underlying needs are. But that's a general idea of like how this process of healing the gut goes. But I think what a lot of people miss out on is really this idea of what else is happening outside of just the 4R program or the 5R program. Things like the liver being sluggish, or, really getting to the root problem of like food sensitivities.
Right. So I think at Physio Logic, we have like this hybrid approach to both detoxify and do an elimination diet. An elimination diet being where we get rid of the main food triggers, main food allergens, foods that people generally tend to react to without even knowing it. So this hybrid approach is kind of a 10-day elimination detox where we throw in some herbs to really support the liver, the 3 phases of detoxification, and also get rid of these, gluten, soy, corn, dairy, just to name a few of like kind of the main food allergens that we'll get rid of, and of course alcohol as well, just to figure out kind of calm all the inflammation, and then slowly add back all the various foods after we've detoxified to see how our body then reacts. And that's often a way that we identify food sensitivities. There's also more extensive testing, but that can usually be like one of the most effective ways to just figure it out right there.
So this idea of liver detoxification can get a little tricky to understand, because isn't that like the whole idea is that the liver is supposed to be detoxing all day long, 24/7?
Hear that
So
every day. Yeah.
you taught me a really great analogy for this that I use with patients. I used it earlier today with a patient. So break down kind of the dishwasher analogy.
Yeah. So we've talked about this if you've heard us on previous podcasts about this topic, but essentially our liver is supposed to be detoxing. That's what its job is, its main job, right? To get rid of these toxins in the body that are not supposed to be there. However, the same way we go through a spring cleaning, you want to kind of detoxify, give that liver a little bit of extra boost. So we have this dishwasher analogy that's super easy to understand where, a restaurant has a normal influx of clients coming in, eating dinner, and they're sending their dishes to the back. In the back, the dishes are being cleaned. It's a nice little cycle. But let's say that it's a holiday and everybody's rushing into the restaurant and you have so many people, way more, you have extra staff. However, the dishwasher is still like this unit that's one size. And so you start to throw in more and more and more dishes and the dishwasher gets backed up. So you have to slow things down and kind of take a step back and help that dishwasher every, let's say, twice a year, for example. So whatever it is, that's a good analogy for how our liver also needs sometimes that extra help ever so often. And that's what this detox and elimination diet really does for your body.
Yeah. And we live in a toxic society. Like there's a lot of things that can bog down and cause this like quote unquote like sluggish liver. And the idea of like, medications have to be processed, our foods have to be processed through the liver, obviously things like alcohol, but especially like processed foods, like high fructose corn syrup, a lot of these like trans fats, like that stuff is harsh to digest. That is not easy on the liver, just as much as alcohol is. And then of course we said medications. Also, if there's things in the body like heavy metals or I think even things we don't even think about, like an oral contraceptive pill or like Advil that we're taking, on a common basis. Yeah.
Also
high levels of
cleaning products, right? We're especially now with COVID, like we're all, using more Clorox and Lysol and all of these products that we're really not supposed to be using that frequently, let alone we're not wearing gloves when we're using it, wiping down tables, right? And so it's getting into our skin and getting into our system and
all those chemicals. Totally. Yeah. So many jokes we could make, but I'll stay strong. But yeah, and then, there's also just things that we see on blood work, like high cholesterol that, that's a burden to your liver also. So just a good reminder that, we do this with the seasons as well, that there's often, at least once, if not twice a year, it is good just to kind of give a little spring cleaning for your body too, a little oil change, and just make sure that everything is functioning at optimal capacity. So going back to this idea of pairing this process, this like detox with an elimination program. An elimination program, I've seen a lot of different types in this field, ranging anywhere from 30 days or maybe even just short as like 14 days, all the way up to like 120 days. And they can be really grueling, and it's usually a really strict, structured diet. So it's kind of like say goodbye to your life for a little while, because you have to just stay on such a regimented program in order for it to really work and for you to really identify these potential symptoms of like food sensitivities. But the idea, we kind of figured out we could hack this by pairing the detox with the elimination diet, because when you go through this process of removing all these inflammatory foods while supporting this liver detoxification and all those pathways, you get all these other levels to start dropping, these histamine levels, other inflammatory levels. And so It's just a little bit more of a efficient way to kind of go about it. And then after the 10 days, you start testing these foods back out when, maybe every other day or every third day. And I think what we have found with our clients is they just have a little bit more of an obvious response. And, at the end of the day, maybe it only took 2.5 weeks to figure out all of this out. So it's not a perfect system, and we do have to change it up for some people and kind of personalize it a bit more for some individuals than others. But definitely a pearl that I would say I wish more people would do this, because I think it would take away the bad name elimination diets have, and kind of help move things along a little bit more.
The next thing we usually test is blood chemistry, as I mentioned a little bit earlier. But we'll start to look into more things that also can bog down the liver, such as hormones, right? If your hormones are imbalanced, it can also, as Michelle was saying, high levels of estrogen can
Yeah.
cause a lot of GI distress. It's not uncommon that, we see women with, estrogen dominance, which just means, you have far too much estrogen that your liver is not able to filter through, or PCOS, for example, a little bit more testosterone, that can cause a lot of GI issues as well. So sometimes addressing kind of those underlying hormones that we're testing through your blood can be super, really tell us a lot about what's going on in the body. Also nutrient deficiencies, right? I mean, I'm thinking vitamin D, various B vitamins. I mean, B vitamins are super important for our energy, vitamin D for the immune system. And, if we're kind of low in a lot of these various vitamins and minerals, it can cause a lot of inflammation and wear you down. And we're talking, I said, it's B vitamins, vitamin D, zinc. What else do we test through the blood?
Yeah, I mean, looking at even like the good healthy levels of cholesterol to see if healthy fat levels are there. It's interesting because it's kind of this like double-edged sword of potentially you're not getting enough nutrients because you're not able to absorb them well enough because of something going on with this underlying cause. Like, do you have low enzymes so you can't absorb your nutrients, or is there so much inflammation in the gut from so many said sources or triggers that like the microvilli that's like in the intestine trying to collect all the nutrients isn't as effective as it used to be. But then also having this nutrient deficiencies causes a lot of the secondary symptoms of IBS, like anxiety and depression and fatigue, brain fog. So it gets really tricky. And I think that's why we take the blood work just as serious as a lot of the other tests, because we know we need to replete those nutrients ASAP so that we can just get somebody feeling better, and maybe just getting their energy up a little bit so they feel like they can tackle something like a 10-day elimination diet.
Right. And what's interesting is, you're saying that we wear down these microvilli. That's really what happens when we have a lot of inflammation, resulting in leaky gut, which
All right. Let's back it up. Let's back it up a minute. All right, take me back to the microvilli, just so everybody understands.
So we've all heard this term, or maybe we haven't, but it's very common, this whole kind of term of leaky gut. And what that really means is our gut flora, they have these little microvilli. So because this is a podcast, I'm trying to kind of, if you wave your little fingers up and down, that's like the microvilli, right? You have like these long fingers that are really great for absorbing all the nutrients, right? And so when your food starts going through the stomach, the GI system, these microvilli are absorbing all these nutrients. However, let's say that there's a virus that comes through, whether it be a foodborne pathogen like salmonella, or something that's a little less, I'd say, obvious, such as an undiagnosed gluten sensitivity, right? So something that you're not aware of, whether it be gluten or maybe a food allergy or a sensitivity to dairy, let's say. There's all these different factors, right? But over time, that starts to create inflammation in the body. And what that looks like in terms of your GI system is these little microvilli start to wear down. So all you have left are really, like if you make your hands into fists, are all kind of these fists. And so you don't have these fingers, these microvilli that are able to absorb all these nutrients. And so over time, the tight junctions of the gut, or I guess these microvilli that are kind of all intertwined, start to separate.
Exactly.
And that's how you start reacting, right? So even though you're eating so much broccoli and kale and good quality quinoa and things like that, they're all starting, your body is looking at them all as these foreign invaders, because your gut starts to be so inflamed, and these tight junctions start to become, I guess I'd even say, like looser junctions. And so
Mhm.
little pieces of broccoli and quinoa and all the good foods you're eating start to get into the blood, which raises kind of our system's antenna saying, let's become inflamed. We got to get all this out of our system. Um, and that's essentially leaky gut, if that makes sense.
Yeah. Yeah. I think of it as I remember doing like a lab practical on this where we had like a sifter, and it was like, okay, pour water through it and then pour sand in and then put like gravel on it. I was like, okay, well, obviously the gravel doesn't go through. Like, some of the sand goes through and like the water goes through, but we would think of those as the nutrients that are going into the bloodstream. Those are the things that are supposed to pass, and like the rocks and the pebbles and the gravel can't pass through. And then basically we like messed with the sifter and made it so that, more stuff could pass through it. And that was like the inflammation damage that would take place. And now like suddenly little pieces of like shale and like gravel were passing through, that ends up in the bloodstream where it's not supposed to be, and your body's very, very well versed on what's supposed to be there and what's not supposed to be there, and it sets off an alarm, and it tags that, and it says, anytime I see that, we got to like upregulate our immune system and inflammatory pathway and go after those guys. But what if that's like a chicken protein, or what if that's like lettuce or something that like is technically a good food, but now you've tagged it as a bad food? And this is often what I'll see when clients come in and they'll say, I feel like every year, like I'm restricted, like my body can't handle more and more food. I feel like the list of foods that I can't tolerate is like growing. People come in with like a list of like 25 foods they can't tolerate. And that is like leaky gut all day long. So yes, there could be a lot of other things going on, but if you don't ever heal, you could do the 4-hour program to the cows come home, like until you do a leaky gut, make sure that you're removing the contributing factors to inflammation, and you're really allowing that lining to heal and seal. You're that inflammatory pathway is what's going to lead everything. Also, just while I'm thinking of it, Dr. Patty, our functional medicine doctor, really well versed in peptides, and she has really taught me the importance of a peptide called BPC 157. Orally, we'll use it for leaky gut, along with a lot of other nutraceuticals that can just kind of speed up this process of like healing this gut lining and really increasing the resiliency of the GI system as well, so that once we get you back up and running, you're less likely for this to happen again.
So lastly, again, we're nutritionists, so we have to discuss diet and lifestyle.
Yes.
And so we kind of touched on this here and there, but really through all this various testing, we always have to address vitamin and mineral deficiencies. And this usually kind of comes in the last of the 4R strategy of reinoculate, right? Because we're throwing in good bacteria, whether it be probiotics, prebiotics to help grow those probiotics, but then also different micronutrients that now that we've healed that leaky gut, we can start absorbing again.
Also, during this phase, this is when we're going to look a little bit deeper into some of the foods that long term you just might not have an easier time to deal with, even if they're not food sensitivities. This is maybe when we'll have conversations about some of the high FODMAP foods, or some foods that have like higher fructose content. Sometimes that can be an issue with IBS patients. But the idea is to really allow you to consume, as great of a variety as possible while avoiding anti-inflammatory foods and avoiding ongoing damage and symptoms day to day. Now, this is going to vary greatly from one individual to another, and we usually try to find, certain. We don't subscribe to any one diet. I think we really kind of find a range of diets between like, we like elements of the paleo diet, we like elements of the keto diet, we like elements of the bulletproof diet, or elements of the Whole30 diet. And I think we kind of pull from a lot of those when we're talking to a patient, seeing what their favorite foods are, culturally what foods they're drawn to, and really trying to design a game plan around that long term. But I also think a lot of the lifestyle elements tend to be kind of overlooked as maybe not as powerful. are like a little bit more like woo woo. And, you know, again, they can't be understated how important those are. So Diana, take me through some of the ones that you really think have the biggest impact with our IBS clients.
Yeah, so I'd say the first one is really sleeping. I think we overlook sleep as such an important, getting at least 7 to 8 hours, if not more. Sometimes your body needs more, especially while it's repairing and healing.
Yeah.
But getting those 7 to 8 hours a night and really having good quality sleep, no animals jumping in the bed, not being waken up ever. And some of it, this is sometimes it's out of our control, but doing what we can, because those sleeping those hours at night are so important to repair and heal and detoxify. Our body detoxifies so much at night, which is why we always say wake up in the morning and have some water, because your body's been working really hard all night. Got to give it a little bit of water to replenish those cells. And then the other one I would say is really important, and there's so many, is laughing. So whether that be watching a funny TV show, YouTube video, just sitting with your partner or your friend and video chatting or hanging out, and just getting that true like deep belly laughs in, so important, just to kind of relax and enjoy life a little bit, right? To not be super uptight.
So I love that you pointed out that specifically, because there's so many benefits that happen. So if you're laughing, you're automatically out of the fight or flight response. You're automatically out of that like cortisol driven stress response. You're getting more oxygen to your body because you're breathing in a different way when you're laughing. You're having feel good endorphins and neurotransmitters circulating because it's an enjoyable experience. And I think it's just as good like mentally as it is physically for that. And I think also, the same idea with like a gratitude practice is, typically you're grateful for those moments of like laughing and being happy and joyful. So it kind of goes hand in hand with that. I love that so much. I also think just like proper movement and exercise, depending on the severity of a GI case, we have to be careful with how much exercise or movement, because sometimes that can actually put too much stress on the system. But getting outside, safe, healthy movement is essential for our body. Good circulation, again, it's all kind of, we need oxygen going to all the cells of the body, including the GI system. So we need everything kind of moving and circulating. And I think often stress is a component that can be frustrating for IBS patients, because a doctor or a practitioner will say like, you need a stress reduction practice. So you need to reduce stress. Or you need to, you need to be less stressed. I don't know. Saying that has never worked. So I think let's stop pretending like just talking about it's going to do something. You have to really put in the work. It's just as hard as changing your diet. So really committing to a movement practice and really committing to, a stress reduction or I consider it like a mental health practice. So, this idea of meditating is great, or like doing yoga or going on a walk in nature. All of those things are fine. It could be doing breath work. It could be singing. It could be like doing like a dance class. It could be really anything you want it to be, as long as it's reducing stress and bringing you joy. But I think it's all just kind of revolving around this idea of getting you out of the fight or flight response, getting you breathing, bringing some joy to your life, getting those feel good hormones going.
Yeah, and I think we're in a stressful time right now, so I think
There's a lot to worry about.
there is, and it's so important, I think, especially because a lot of IBS, at least our doctors, a lot of time doctors are saying, it's all mental, right? Michelle was just saying, you gotta, figure out a way to decrease your stress in your life. So I think that there's a lot of truth to that, and figuring out like what works for you, whether it be learning, how to take a deep breath. Sometimes I think we're all stuck in a shallow breathing, or whether it be just sitting outside in the sun, like figuring out what works for you, just to keep you calm and kind of static throughout the day, instead of like having these high highs, low lows, and moving up and down, and our stomach just going with it.
I also think this is probably, if whatever the hardest thing for you to do is probably the area where you should call in help. And so, we're hired because people need help with creating a plan to, you know, get their health and their diet back on track. So if you're finding that like your finances are stressing you out, you know, hire a coach. If you're finding that you aren't committing to your workout regimen, hire a coach. If you're finding that, you know, you're not meditating, you know, get a group of people together and create an accountability, you know, situation. Like I started doing breathwork classes because that wasn't something I was going to do on my own. Like I was not making it a priority. So I needed, you know, put some skin in the game and kind of like step, you know, up the ante and like step up my commitment to it. So I also think that's an important thing to do as well, is just know yourself. And if it's something you want to do, there's ways that you can get it done. You might just need to call in and some experts so you can really make sure that happens.
Yeah, and you know, everyone's experience with IBS, as with any symptoms and situations, is really going to be different. And so Michelle and I have really laid out, I think, kind of like an extensive high overview of kind of what IBS can be, what the various triggers are, what a lot of the underlying causes are. But there's really no one size fits all for really anything in functional medicine. But as it pertains to IBS right now, there's really no kind of band-aid approach, one size fits for everyone. So we're here just to kind of lay it out for you, and give you all the various options and the different paths that we would go down if you came in as a patient. But yeah, with that, we would love to hear from you. If you have any questions, comments, give us a like on Instagram, give us a 5-star review.
And also, yeah, if we missed anything that you really feel has helped with your IBS journey, you know, the whole goal of this is to educate and share information. So please, you know, send us an email, you know, message us. You know, we're always looking to connect with the audience and to kind of learn and grow from each other.
So feel free to reach out to us via our Instagram at Physio Logic NYC, or send us an email at funkyouup@physiologicnyc.com.
And as always, you can follow me on Instagram, MichelleMiller_MSACN. Thanks for joining us, guys. We'll see you next time.
You've been listening to Funk You Up. Be sure to like, review, and subscribe for more daily tips on living well.